Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
It's always great to talk to these beautiful women, and Monique Barbour, Dr. Barber, certainly is that. Good morning, Dr. Barber.
Good morning. Thank you so much for the compliment.
Oh, it's true, though. And did you see I guess you saw the magazine where we had a picture of you and your daughters?
Yes, fabulous.
Okay, so we just had Dr. Mencia on, and he was talking all about prescription medication and the dangers of not knowing what you're taking. And by the way, I am going to make an appointment and have my eyes checked by you, so you can be expecting me.
Sounds good.
Okay. So tell me now, what is new or just what generally for older adults, they're going to go and just have you check their eyes to see if they have glaucoma, or what is the most important thing that you do with the older adults when they come in?
Well, generally speaking, we conduct most routine examinations. During that exam, we are able to screen patients for cataracts, glaucoma, and for any complaints that they may be having when it comes to their eyes.
Well, now one thing I notice that people have itchy eyes. Is that an allergy, or is that something to do with their eyes?
I believe most complaints with regards to itchiness of the eyes is a multifactorial condition. These, the top three problems, I would say, are seasonal allergies. For women, we always think of makeup and exposure to products in and about the eyelids. Also, other medications can cause itchy eyes. So we always go through a thorough history with the patient to rule out one of these causative factors.
Yeah, that's because I know from time to time. And the worst thing is, I feel sorry for my little eyes. When I have itchy eyes, I start rubbing and rubbing and rubbing. And my husband said, "Stop rubbing your eyes." And I said, "I can't." And so I get ice and I put it all around there, and that usually stops it.
That's a great idea. I recommend ice also in the absence of prescription eye drops to remedy the situation. The number one prescribed drop for what we call allergic conjunctivitis is usually something like Pataday or Nafcon. Those are things that you can get over the counter. There are many things that you can get over the counter for allergy relief. But for prescription purposes, there's Pataday, which is once a day, which is a wonderful drug, and it alleviates most of the symptoms associated with allergic conjunctivitis.
I never heard that word before, allergic conjunctivitis, because we know that when people have conjunctivitis, their eyes are all red, and it's very, isn't it also highly contagious?
Not necessarily. When we think of contagious conjunctivitis, we're mostly speaking of a viral condition, or it could be an acute epidemic of a bacterial conjunctivitis, which, yes, can be contagious depending on the condition.
So getting into this with when you have a patient who does come in and you see certain things that are wrong, for instance, you have a new process that's you do treat cataracts and astigmatism with a new procedure. It's one procedure as compared to what other things would someone else do?
For cataract surgery?
Yeah.
For example, there's so many wonderful options with cataract surgery when it comes to the decision the patient needs to make as to whether or not they want to continue using glasses post-operatively. We have several types of implants available, and the newest thing, Anita, is the laser-assisted cataract surgery. This is something that's revolutionary and really cutting edge. the technology is hot off the press. There is a laser available. The one that I use is called a LENSAR, and it is capable of not only making the incisions that I usually make by hand, it will also fragment the cataract material and make it more, I would say, easier to remove the cataract. The LENSAR is also able to correct astigmatism. That is one of the incisions that are made on the cornea to correct astigmatism. So,
what is it? Will you explain what an astigmatism is?
Astigmatism, in layman's terms, is something that occurs when your eye is not round like a basketball. The shape of the eye or the shape of the cornea is mostly resembling that of a football. So it creates one axis which is flat and the other axis which is steep. When we evaluate the patient for surgery, with all of the technology that we have, we are able to see the astigmatism. We're able to locate the exact axis of the steep curve of the cornea. When we see this, we're able to guide the laser to flatten that axis. And it's as simple as that. The laser is calibrated so that it flattens the steep axis, corrects the astigmatism in doing so.
Once you have this surgery, do you ever have to have it again?
Generally speaking, no. Once the cataract is removed, you'll never grow another cataract. It's gone completely. Fortunately, right?
Right.
Astigmatism, however, can regress, and your cornea can continue to change as you get older, but not dramatically so that the entire amount of the astigmatism regresses.
Do you have many patients who are totally blind?
Yes, I do. We have some patients who, for many reasons, are totally blind. One curable condition that results in total blindness on both eyes is definitely cataract. And we see this sometimes when the patient has no access to insurance to be able to treat their cataracts. The other thing that we have to keep in mind is that some patients are fearful of having surgery, and they don't understand that cataract surgery is an operation which, at this time, can be very fast, and the recovery is almost immediate. So they don't understand this until they come in and get more information. Another condition that can cause total blindness is glaucoma. And this is very prevalent, especially in South Florida, among the African American community. And it's something that we also routinely screen for. It is a silent disease, so there are no symptoms, no pain, no discomfort of the eye. The eye does not turn red. Quite often, we see patients, and they're not aware that they have glaucoma. Sometimes we see patients that have a family history of glaucoma, and they suspect that they may have it. I've seen a few patients this year, and they have come in to get their eyes checked, thinking that they're not able to see well, and it turns out that they have very advanced glaucoma. Once we diagnose this condition and stage it, it is very difficult to regress. There is no cure, and there's no way to reverse the damage to the eye that's done by glaucoma. Anita, I would have to say one of the biggest reasons that I also see blindness, new blindness in young patients is coming from diabetes. we have quite a few people in the community, patients that do not understand or they're not aware that diabetes can cause problems with the eyes. So we would like to urge every diabetic patient to come in, have your eyes screened for diabetic retinopathy, and also be mindful that the hemoglobin A1C should be under 7 to prevent ocular involvement.
So it should be under 7. Well, I always said that older adults, of course, should have a yearly examination with an ophthalmologist, but how young should someone come? Maybe they don't know they have diabetes, and you'll be able to detect that.
Exactly. This is what can happen at times. We generally recommend an eye screening for everyone over the age of 40 because it helps us to screen that person for glaucoma and some of the other entities that they may not be aware of.
That's a good idea. Why does diabetes affect the eyes? It affects other things, of course, but it seems like the eyes are, I never hear that a limb is going to fall off from diabetes particularly, but I guess you do have to have amputated legs when the diabetes.
Absolutely.
But why are the eyes, why does it affect them?
Well, interestingly enough, the basic physiologic or pathophysiological problem with diabetes is that it ruins your blood vessels. In particular, it ruins the small blood vessels, and we can actually see those blood vessels inside the eye. When I look inside of your eye, I can actually see your arteries and veins. So at the microscopic level, the basement membrane of the blood vessel that takes the blood cells from point A to point B, the blood vessel itself has a muscle, it has a wall. The walls of these blood vessels are broken down by the diabetes process. These blood vessels eventually leak protein into the space. So the space happens to be your retina. The proteins leak down into the space, and this is where the blindness occurs.
And
so I'm actually privileged to be able to see this physically when I examine a patient.
Well, once this occurs, though, you can't cure that blindness, can you?
Well, we have treatments. We have a protocol that was published over 20 years ago, the Early Treatment Diabetic Retinopathy Study. And this is still a wonderful standard that we use to stage diabetic retinopathy and come up with a treatment plan. We treat diabetic retinopathy with a combination of laser treatments, and the newest thing is to use injectable medications to stop the process. However, the damage is already done, and we can only advise the patient and the primary doctors to continue to work on the hemoglobin A1C and have better control for the diabetic patient.
Let me just tell everybody, this marvelous ophthalmologist knows so much. And it's funny, we never rehearse this. For people listening, she and I we just start running with it. And I know usually my guests and how capable they are, just as I do with Dr. Mencia. And I know Dr. Barber is so smart. And she's not scripted. Right now, she's just doing this because she knows. So I love talking to her. But let me just tell you who she is then, where you can make an appointment. So Dr. Monique Barbour, Barbour, and she is, she started a center called Clearview, CLEARVUE Center. It's over there, in Western Lake Worth Road in Lake Worth. It's 7657. And you can call for an appointment. I'm going to call and make an appointment and have my eyes checked. And why don't you do the same thing? Phone number is 561-432-4141. That's 561-432-4141. And you can go on their website, which is Clearview Now. Clearview Now. Wouldn't you like to have that? Clearview Now, CLEARVUE now.com. And I know that you'll be very happy meeting her. She's charming and very smart, and she really does try to help people. I know that. How's that other situation going over there in Pahokee?
Fantastic, Anita. We had a great event back in October. We hosted and sponsored a 5K run/walk. It was called I Run, I Walk for diabetic retinopathy. We had a wonderful turnout on a bright, sunny morning to create awareness and educate the people of this community in Pahokee. I've seen a lot of diabetics in Pahokee, and it moved me to be able to expose them to the education that they need to better manage their diabetes and prevent vision loss from diabetes and diabetic retinopathy. So we're looking forward to doing the event again this fall, and I will keep you posted as to the date, but we're so excited to go out and host it again. I think it's a wonderful event.
Right, and I would be very, very pleased to help in any way, because I think going out into a lot of the rural communities where people are not as aware is astonishing. And even if you save one or two people's eyes, it's worth doing that. I wanted to go further on now with what you were talking about with, one thing I've heard about dry eyes, and I'd like to know what makes people's eyes dry and what can they do about it?
Well, very hot topic, and I'm glad that you brought this up, because this dry eye disease is a serious entity, and it's affecting millions of people. It's something that almost, I would say, 99% of patients that we see are complaining of, including children. One of the biggest causes, I would say, and there are many, many causes, many, many factors. One of the biggest issues right now, Anita, is that everyone is either on a tablet or a cell phone or a computer for so many hours during the day, and they're simply not blinking. So this, in turn, makes the tear evaporate too quickly. So patients will come in complaining that their eyes are burning or red, or that the eyes feel tired. We go through a careful history to discover that, yes, they're on their cell phone checking email or reading documents on their cell phone, or even watching a movie, or they may be playing video games when it comes to children. So the first thing that we do is counsel them with what we call the 20/20 rule, which basically states that if you're on your device for 20 minutes, you should take 20 minutes off of your device to rest your eyes. And I think that's a wonderful rule of thumb that we use, and everyone in my staff understands it, and they can explain it to the patient as well. Other causes of dry eye.
Wait, before you get off that, I love that. So it's the 20/20 rule. So if I'm on for 20 minutes, I then have to get off for 20 minutes.
Exactly.
Whoa. That's unique. And I'd like to do a little article on that one. I have to find some information and all. I think that is such good information for all people, all ages.
Absolutely. And it's tied to something called digital eye syndrome, which you may or may not see in the literature at this stage. I don't think there's a national multi-center task out to explore this entity, but it is out there as digital eye syndrome, and what we're recommending is the 20/20 rule. I think that's a wonderful way to start to manage dry eye on specific patients who are exposed to computers and tablets, etc. Indeed.
Okay, so now what other things cause dry eyes?
Well, what we have to look at, again, and it goes back to the history of the patient, is medications. Medications are a big cause of dry eye syndrome. Some of the high blood pressure medications can cause dry eyes. Some chemotherapeutic drugs can cause dry eyes. Some of the anti-cholesterol medications, the statins, can cause severe dry eye syndrome. Even some of the osteoporosis drugs are causing dry eye. So we have to take a thorough history and rule out one of those medications. Occasionally, the patient can be switched to something different to manage their dry eye or to manage their systemic illness. Occasionally, they cannot. So we have to, again, take those things into consideration. Other causes are environmental, hormonal. One of the biggest problems also is patients that have rosacea are suffering with dry eye symptoms. So we have to manage the rosacea patient a little differently, I would say, than an evaporative patient. Some of the treatments now for dry eye are very aggressive. We start with, again, the 20/20 rule, and I always recommend artificial tears, usually non-preserved, for starters. And I usually see the patient back a month or so after they've done these couple of things. If they're not improved on tear replacement therapy, that we then move to a prescription drug, which is Restasis, which is made by a wonderful company, Allergic, which also makes Botox. This drug actually promotes production of your tear. So we can increase your tear productivity using Restasis. We also have a device that we can put into the eyelid called a punctal plug to shut down the evaporative problem. So this is like plugging a drain. Every time you blink, your tear goes down into your tear duct. So we plug the tear duct, and it leaves your tear floating so that your eye can stay more lubricated. Now, one of the more advanced things that I recommend are omega-3 supplements or fish oil supplements. But not all fish oil supplements are the same. The ones that I recommend are the specific compound containing the triglyceride component that has a receptor in the eye. So it affects the tear film in a way that other omega-3s are not able to. Just recently, Anita, a wonderful treatment has come about for dry eye symptoms, and in particular for patients who have dysfunction of the small glands inside the eye that are responsible for tear production. This treatment is called LipiFlow. LipiFlow. I don't think you've heard of it, have you?
No, not at all. I'm sitting here with my mouth open about all of this. I need you to do some writing for us. This is so fabulous.
Absolutely. The LipiFlow treatment is a treatment that basically works under the premise of opening the glands that are responsible for the oily component of your tear. And it is a device that massages the eyelids for about 10 to 15 minutes, and it releases those glands so that your tear film can become balanced again.
What is it called?
LipiFlow, Lipiflo.
Well, I love this, and we're about to run out of time, but we're going to have you back on. These were incredible subjects. I really admire you so much, and we are going to have, of course, another cure symposium, and I want to talk to you about that also. You are really astonishing. So I want to thank you. We'll get you back on again to cover some more of these issues.
Thank you so much.
Thank you, Dr. Barber. Okay, bye.